Hey, Dr. Derek Nielsen here. I'm the owner of Kaizen Physical Therapy, where we help people who are age 40 years and older who have been dealing with pain for 6 months or longer. And we help them get back to being active, mobile, without pain meds, injections, and surgery. And today I want to talk about, as the title says, I want to talk about osteoarthritis and how it compares, or what it has in common with wrinkles on the skin. But first, before I forget, I did just author a book. If you're serious about trying to find a pain solution and you want to know what the real cause is, I made a book specifically for you. You can find that free for download at thepainreliefbook.com. It's taken me over a decade to learn, $300,000, really to learn this stuff, and I'm giving it to you for free. Anyways, back to the topic is osteoarthritis and wrinkles on the skin. What do they have in common is we're both going to get them. As we age, osteoarthritis is extremely normal, and it's usually not the cause of pain. So it just happens to be something that we can see on the x-ray or MRI. And this is an important topic, is x-rays and MRIs can be very valuable, but they can also see things that aren't really the cause of pain. And that's because we can't see pain. So when you take an image of your body, even though you see something scary on it, say osteoarthritis or a herniated disc or something, that doesn't always mean it's the cause of pain. It just happens to be something that we see on an image. And even though we see something scary on an image, you can't see pain. And that's one of the things I dive into deep within the book, that I would say go and get it and read it, thepainreliefbook.com. And this is stuff that I talk about. There's people in their 20s that have been diagnosed with osteoarthritis. There's people in their 70s that don't have it in certain parts of the body. But one thing we know for certain, as you age and get older, the likelihood of getting osteoarthritis goes up with every year. And again, it's usually not the cause of pain. What we can do is look at movement. By looking at movement, we can figure out what's not moving or what's not acting the way it should. And this is going to be a much better indicator of where the cause of pain is, because the far majority of the time, things that hurt, they hurt because they're overworked. And they're overworked because somewhere else isn't working like it should. So for example, with low back pain, a lot of times that I see in the clinic is the hips aren't moving like they should. And when the hips don't move well, somewhere else has to take up that slack or take up that motion. And as you move throughout the day, it happens to be the lower back that has to be more mobile if the hips aren't moving like they should. And so the low back hurts, but it's not a low back problem. It's actually a hip problem. And so we can't just go off of pain, just like we can't just go off of an x-ray and say you've got osteoarthritis, that's the cause of pain. Again, if you're looking for a pain solution, go ahead and read the book. Download it for free at thepainreliefbook.com. And I hope you enjoyed this, and I'd love it if you share it out. Thanks so much.